Good morning. Nice to see you all. My name is Andy Beinman, and I am the Executive Vice President and Chief Medical Officer for Kaiser Foundation Health Plan and Hospitals. I have served as the Planning Committee Co-Chair for this workshop with my colleague, Dr. Derek Angus, who is Executive Vice President and Chief Innovation Officer at the University of Pittsburgh Medical Center. On behalf of the National Academies of Sciences, Engineering, and Medicine, we'd like to thank you all for attending this virtual workshop. This event is the fourth in a series of workshops funded by the Gordon and Betty Moore Foundation to examine diagnostic excellence. We held workshops on sepsis diagnosis in 2020, on acute cardiovascular events in April 2021, on cancer diagnosis in late 2021, and we'll be holding another workshop on diagnosis for older adults later this year. Additional information about these other events can be found on the project website. You can advance the slide, please. I want to highlight some lessons learned from the three workshops we've already had, because I think this will help to set the scene for today. One of the things that has come through in previous workshops has been that we've discussed how diagnosis is both a noun and a verb. That is, diagnosis is something that is arrived at, in a sense, given to a particular patient with a set of conditions, and in some ways is a destination. And in other circumstances, when we talk about diagnosis, we're talking about the process of how that destination is arrived at. And both of them have meaning of different sorts, and we will explore in some ways that different meaning and how they are important in different ways to patients and clinicians as we pursue diagnostic excellence. A second theme that has emerged from these workshops is that there are improvement opportunities in that diagnostic process prior to specialized care. In many cases, the conditions that we're talking about end up in the hands of specialists and patients working with specialists, but that there were opportunities along the way to improve diagnosis that might have prevented some of the conditions from emerging in the first place, or from more severe forms of the condition from ever emerging. And so we have focused on that at different times in ways that earlier part of the process of diagnosis could be enhanced to improve care for the patient. A third issue has to do with multiple factors that can contribute to the disparities in diagnosis. It's been noted in each of our prior workshops that there are disparities by race, ethnicity, and other social factors that contribute, that are seen in the stage at which diagnosis is made, and this has impact on the health outcomes of patients. And we have examined how different components along the way can contribute to those disparities. That will be addressed today as well as a very important aspect of what's been observed about COVID and how there needs to be improvements to address inequities in the diagnosis and care of COVID patients. Another observation has been that the pursuit of improvement in diagnosis is often siloed. That is, different investigators, clinicians focused on different aspects of diagnosis often work within their own areas of expertise, but that there's been limited work to connect in some cases. So an example that has come forward has been, there's often a lot of work going on in the area of biomarkers or other kinds of physiologic measures related to a condition. And then at the same time, there may be a lot of work going on in the area of large data and ways of using information technology to support diagnosis. But those two worlds don't always align with one another, and that the opportunities for improvement may be siloed, missing opportunities to enhance a diagnostic process. And then finally, I would say that a key theme that has come through in these workshops has been how important it is to listen to the patients and their caregivers. Patients and caregivers do often care about diagnosis as a noun, but the process is also critically important to them, how they feel a part of it, how they feel heard in something that is so important in their identity and how they perceive their health. And that we have brought forward in each of these workshops important examples of how patients and caregivers can contribute to improvements in the diagnostic process. Yes, we've had some really revealing and striking things come forward in these workshops. In our previous one on cancer care, for example, we did note how the diagnostic process, for example, in cancer, can go down particularly different pathways in different countries that think about this. So, for example, we did talk about how in the US, screening is such a fundamental part of how we try to improve diagnosis in cancer in the US. And while screening is an important component of cancer care screening in the UK, there's also been a greater emphasis provided there for pursuing pathways related to symptoms. So these kinds of differences have been important in enlightening us all about ways that we can improve the diagnostic process. Next slide, please. The workshop today will examine changes to diagnostic paradigms in response to COVID-19 pandemic and consider lessons learned and opportunities for improving diagnosis within the US healthcare system. This workshop will discuss topics including the vision for excellence in diagnosis, challenges and opportunities in diagnosis, disparities in diagnosis and strategies to promote equity, diagnostic pathways, and novel tools for diagnosis. I now turn to my co-chair, Dr. Angus. Derek, please provide us with some remarks regarding the planning committee and the overview of the agenda for today.
Thanks, Andy. So first of all, I'd like to start by acknowledging that Andy and I are both incredibly grateful to the members of the workshop planning committee who really helped shape today's session. It's a wonderful multidisciplinary group to bring together expertise that reflects some of these emerging lessons around diagnostic excellence. And I think Andy and I both feel that this multidisciplinary group then functioned in a very interdisciplinary way to try to think through how we would structure the day. It's not just the members of the planning committee, though. We'd also really like to take a moment to thank very much the Gordon and Betty Moore Foundation for their support of their entire process, this entire series and this particular workshop. I'd also like to acknowledge that we wouldn't be here today if it wasn't for the really terrific support from the National Academy staff, from Jennifer Flaubert, Ruth Cooper, Anisha Wilkes, and Cheryl Ness. Just to keep us moving along, let me just go through a little bit how we've organized the day. It's going to be a tight, busy day. We're going to have a keynote speech to get us started. And in thinking about how to organize this workshop, we felt what agency or institution had the best grandstand view of how the entire healthcare and biomedical science enterprise had to adapt and respond in thinking about diagnostic excellence in the face of this new disease. And so we're really delighted to have Eric Rubin as the editor-in-chief of the New England Journal of Medicine, because surely the leadership of a major medical journal had such a grandstand view. And so we look forward to his talk to launch the day. Thereafter that, we're going to go through 4 very busy sessions, each with 3 or 4 speakers, tackling intersecting themes that try to draw out some of the lessons that have already been learned from thinking of other diseases, and which we think may have then further made us reflect differently with COVID. So in the opening session, we'll talk about the impact of COVID-19 pandemic on diagnostic pathways, but then also on perceptions at the level of scientists, clinicians, patients, and society about diagnosis, and how those might change by setting of care. That variation then gets unpacked further in session 2, where we try to understand to the extent to which differences in how things have played out could have exacerbated inequities during COVID-19 pandemic, exploring mechanisms, and of course, therefore, thinking through what we might do about it. Session 3 then leads into what we think COVID particularly has shone a light on, which is the relationship between diagnosis and public health responsibility. Diagnosis, by definition, sounds like a very personal thing, establishing a diagnosis in an individual, but COVID-19 has really shown that it has these huge public health ramifications, even as alluded to in this morning's New York Times, and this will be unpacked in this session. And then, of course, all of this has implications for how do we still do the important work of establishing new diagnostic strategies in the face of new diseases? How do we develop them and then disseminate them effectively and nest them into the overall healthcare delivery mechanisms? That will be addressed in session 4. Lessons learned, things that were tricky, could have been done better in COVID, and so on. Presuming we get through these sessions and everyone is still standing, we're then going to wrap this intense Friday with some wonderful luminaries that are going to help articulate their vision for the future of diagnostic excellence and how they see that through the lens of COVID-19. And so that will be it. It will be an intense, busy day, and hopefully we will see some themes that carry throughout the day. Okie doke. So with that, I do want to remind everyone that this is an open, on-the-record session, and we value everyone's participation in the workshop. So please submit any questions you have into the discussion box below in the webinar live stream. Please also include your name and affiliation when submitting your questions. We're going to try to get to as many of the questions as possible during the Q&A sessions that are built into the end of each session. Please also be aware that any comments you provide to inform the discussion may be used in the development of our workshop proceedings, which we're going to put together. Sorry, excuse me a second. My screen was doing something funny there. Please be aware that the comments that you put in could be used when we put together our workshop proceedings document to summarize today's discussion. This is going to be a public document. Also, please note that the biosketches for all of today's speakers are available on the project website. And finally, I'd like to remind that the sessions are being recorded and will be archived online after the workshop.